Okay, welcome everyone to Class 9 of the Chicago Area Homeopathy Study Group. Today is December 7th, 2010, and we're going to review the case of Ramsey from last class. We'll go into the remedy analysis of the case and the remedy prescription, and we'll do a brief follow-up of how Ramsey's been doing. He's actually doing much better in just a month, so that's great. And also wanted to let you know that this is going to be the last class for now. So if you're interested in following up on the continued progress of Ramsey, or you have other questions on homeopathy, the easiest way to do this is to go on Facebook. We have my practice has a professional page on Facebook called Progressive Chiropractic Wellness Center. And then if you go onto that page, you'll see down at some point on that page, you'll see that there's an event, which is the Chicago Area Homeopathy Study Group. If you click on that, you can then post comments or ask questions and continue to follow the progress of Ramsey. I'll also probably be putting on there other interesting events or facts or things pertaining to homeopathy. But also just by liking the business professional page, Progressive Chiropractic Wellness Center, you'll be able to, I post things every few weeks that will talk about natural health, chiropractic, homeopathy, and all kinds of natural health diet things, so you'll get interesting information. Or you can just send me an email to DRE for Dr. E at progressivechiropractic.com, or just go to the website progressivechiropractic.com. You'll find my email there, and you can always contact me that way. So last week, just to kind of review, Ramsey was suffering from anxiety and depression and sleep loss, insomnia, which he was treating to some degree with both anti-anxiety medication and quite a bit of alcohol every night before bed, on average about 5 or 6 beers or drinks per night, just to help him sleep, in addition to, I believe he's using, was he using Ambien as well? Do you remember?
I don't know, you mentioned that.
Yeah. Also back pain, dental problems, sore jaw from grinding his teeth at night, right hip pain, low energy, knee pain, some other spinal pain, and those are the main symptoms. So he is quite a bit better from the remedy that I prescribed, but I'd like to talk now about how we decide what remedy to choose. So we've talked before about the process of homeopathy. The first is case taking, and then the second one is case analysis. So last week you got to see the case taking. Now we can talk about analyzing the case. So analyzing the case, as I've said before, involves whether it's an acute case or a chronic case. You need to assess which symptoms are most characteristic. So given an individual who is anxious and depressed and has low energy and relies on alcohol to sleep and has all these different pain, given a patient who's like that, what about Ramsey makes Ramsey unique? What's interesting, characteristic, striking, unique about him that characterizes him as a person and characterizes his symptoms as being unique? Those are the symptoms that we're going to use that are going to be most important to determine what remedy is going to be most similar to Ramsey and his set of conditions, to the disease that we're looking at, and the remedy that's most similar to the condition or the person is the remedy that's going to bring about cure. So, does anyone have any ideas about what they consider to be most characteristic?
About Ramsey?
About Ramsey, yeah. What symptoms did you think were noteworthy? Do you remember? Or did you, I don't know, did you actually go into it and make notes, or?
I did. I didn't bring them with
Yeah,
me,
okay.
of course, but I think the depression seemed to be noteworthy because it was something that was with him for an extended period of time.
Okay.
Also, he seemed to get frustrated over small things,
Mm-hmm.
and not so much over large things, which I think most people tend to have the reverse. Big things kind of, throw them off, and the small things, at least it's been my experience. So I found that very unique and
Okay.
interesting, that little things seem to really, really.
If we get some more, we'll put them up on the board. So I agree,
Okay.
the frustration at small things,
Mm-hmm.
sweating the small stuff, and
Mhm.
there's a way we find that in the repertory. It was a good symptom.
Mm-hmm.
Any others?
His lack of appetite.
Okay.
He mentioned that sometimes he would just forget to eat.
Yeah. So it's true that for some people, when they're upset, anxious, depressed, some might be more hungry,
Mm-hmm.
some might be less hungry. But if you think about it, most people, like, you have to always ask yourself, how common is this? So, for example, like in a common cold, how common is it to have a runny nose?
Okay.
You know, so for someone who's depressed, how common is it that their appetite's going to be lower?
I see.
Pretty
Right,
common.
Right.
So you'd want to consider that. It wouldn't
Mhm.
be a symptom that you would use to guide you towards
Mhm.
the remedy, but it could help you differentiate.
Got it.
So one thing we look at, you can kind of put in your mind, again, whether it's an acute condition or a chronic problem, is
Mhm.
differentiating versus guiding symptoms. So a guiding symptom will guide you to the remedy. It's something that really stands out as being really important.
Mhm.
A differentiating symptom, once you've done all that, you might narrow it down now to 2 or 3 remedies.
Mhm.
And some might have depression where they have more of an appetite, and others would have depression where they have less of an appetite.
I
So
see.
then you could use that to decide between 2 at the end.
Okay.
But yeah, so it's something that, all of the information you gather is important. It's not that some is important and some isn't. It's just the matter of degree. So some is more important, some is less important. But you want to look at all of it.
Mhm. I also remember that he had a wart.
Mm-hmm.
Is that something that's kind
Yes.
of distinguishing?
Mm-hmm. So warts are very good objective symptoms. And an objective symptom, so a subjective symptom is one the patient can tell you they're experiencing, and an objective symptom is something that you can observe. So a subjective symptom, an example would be, the pain feels like this, it's better or worse like this.
Mhm.
It's something that the doctor or the person prescribing can only gather by asking the patient. The patient's telling the doctor what the symptom is. An objective symptom you can see for yourself. The face is red, the person's perspiring, they're irritated, they're agitated, they're restless. Not that they're irritated or agitated, they're actually physically restless.
Sure.
Or a wart is a really good one to use. So that's a good objective symptom.
Did you also note that there were cracks on his heels?
Yes, I did. And so that's another good objective symptom. And there's certain ones that just happen to be especially useful. More in chronic prescribing than acute. So those objective symptoms that are with someone for a long time, like a wart or a cracked heels, those are really important. They tend to be even more important in a chronic case. Whereas like in an acute case, they're not going to develop a crack,
Sure.
overnight, yet they have this fever or flu or whatever it is. So, however, that said, there are many times when knowing a person's overall constitution can help you in just differentiating between what 2 or 3 acute remedies you might be deciding. So someone might have, like for example, in a case of a cold, just a common cold, very often just for a common cold, the remedy you're going to prescribe is actually the remedy that the patient needs on a chronic or long-term basis. So knowing those things could help you differentiate.
Okay.
But so yeah, so the frustration, the language of the repertories was written 200 years ago, most of them.
Mhm.
So, or longer. So that would be anger at trifles.
Oh, okay.
That's a good rubric that we can use.
Okay.
Or the warts is another
Mhm.
good one, and the cracked heels is another good one.
Mhm.
And so it's interesting when we start talking about this, the frustration at small things, that was very evident, and that's something, but it's not, we're not just listing symptoms here, we're not just listing anxiety or sadness
Mhm.
or insomnia. Those are not characteristic, those are just describing it. Those are just a laundry list of symptoms. So
I
we're
see.
getting into, given someone who has all these problems, yeah, he has cracked heels, he has warts, he gets very irritated at the really little stuff.
Mhm.
What else do you remember?
I thought it was interesting that he had pretty serious internal organ crisis with a twisted contorted
Mhm.
intestine, and had to have a surgery about, I think 10, 15 years ago, I can't remember.
Mhm.
And then he said he doesn't have much appetite, but when he craves red meat, something with high protein,
Mhm.
you know, and which seemed like his body is not getting enough protein or nutrient with the scar tissue that he
Right.
has developed.
Maybe.
now.
I mean, you don't know for sure. You don't want to. You never want to assume.
Right.
But we do use food cravings as usually a food craving could be anything from a guiding symptom, really important, to as small as a differentiating symptom. And the difference would be how intense it is. So if this patient says he needs to eat, he wants to have a steak 3 times a day, every day,
Yeah.
that would be a guiding symptom.
Okay.
If he happens to like meat and he wants to eat it, a few times a week, it's more, he just has he happens to really like meat, and it would be more of a differentiating symptom. So in his case, and so when you're taking your case, what you can do is you can grade the symptoms as a 1, 2, 3, or 4. So 4 would be he's wanting meat 3 times a day, every day. He's been like that his entire life. That would be a 4. 3 would be he wants meat every day, maybe twice a day.
Okay.
2 would be he likes it every day or 2. He really wants to have it. 1 would be he likes meat. Yeah. So I graded the meat. He said he likes meat. He likes to have it pretty much every day. But he didn't say multiple times a day. So I considered that to be a 2, which is significant.
So it goes from 1 through 4.
Yeah, and that's just a method of doing it. So in the case of, if someone had a sore throat or a flu, or you walk in the room and their face, the first thing you see is this dark red face, and you don't even have to look closely to see the dilated pupils. Those things might be like a 4, a 3 or a 4. Whereas if their face is more red than it normally is, that's maybe a 1 or a 2, depending on the degree. Okay. So good. So food cravings are definitely helpful to differentially diagnose. And the other one was salt. He liked salt as well. So.